For too long, the SEN system has been characterised by delays, complexity and barriers that prevent children from accessing the support they need. So Nikki's review, which you referenced there in 2022, Too Little Too Late, and subsequent advice papers have highlighted systemic failings, including excessive delays in statutory assessment and statementing, and a lack of early identification and intervention of children's needs, insufficient capacity and resources in schools and support services, poor coordination between education and health, and a lack of meaningful participation by children, young people, families in decisions that affect them. From our annual casework and legal review, and in terms of special educational needs, the statistics show an increase in complaints to our office on this matter from 36% to 47%. So that's an 11% increase in 1 year. I've seen many cases where school is unable to meet the needs of the child, or where the education authority is not communicating with parents effectively. I've seen examples of children with literacy support needs, and where changes in LITs have resulted in a child experiencing extreme anxiety and leaving school as a result, or a parent whose child is counted as being in contingency arrangements, has no school start date, no communication from EA, and even no physical classroom or appointed teacher, yet they're being counted as being placed. And Nikki stands ready to support the committee in ensuring that this reform is not only well-intentioned, but effective, rights compliant and resourced to succeed. SEN support depends on effective cooperation between education, health and social care, including SLT, OT, CAMS, diagnostics and social services. It would be useful if the committee would seek more clarification on how health and education cooperate, including mechanisms for practitioners to make referrals on identification of need and at what age this happens, and improve communication engagement with parents and carers and with schools. And in fact, the Too Little Too Late report proposed new methods of communication and transparency with regards to the same process. Embed transparency and accountability. So we need published, accurate, timely data to establish clear governance and ensure robust scrutiny against legal duties. We need to operationalise joined-up working, so partnership between education, health and social care must move from aspiration to practice, particularly for children with complex needs. There is an urgent need for comprehensive published data, including on LITs, outcomes, waiting times, unmet need and equality impacts. Transformation must remain subject to effective scrutiny to ensure alignment with statutory duties and children's rights.